Welcome, Curious Minds. Today, we're jumping into a deep dive on a topic that, well, you might not hear about every day, but it's a really significant threat. We're talking about contagious bovine pleuropneumonia. Thankfully, most people just call it CBPP. Our mission today is really to unpack this thing, figure out what CBPP actually is, how it spreads. It uses some sneaky tricks, apparently, and why it's just so hard to control globally. We're trying to get behind the scenes, understand the complexities that make this disease such a challenge for animal health experts.
Yeah, and I think you'll find there are some genuinely surprising aspects to CBPP. We want to make this complex subject really clear for you and especially focus on why it's proven so incredibly tough to get rid of, even though, large parts of the world haven't seen it in decades.
Okay, let's dive straight in then. For anyone listening who's maybe not familiar, how would you sum up the core problem with CBPP? What makes it so bad for cattle?
Well, put simply, CBPP is a really brutal lung infection. It just sweeps through cattle herds. It's a severe respiratory disease, highly infectious, causes massive damage to the lungs, and, well, sadly, it's often fatal. The bug causing it is a bacterium, a Mycoplasma mycoides, subsp. Mycoides, specifically the small colony type, or MMSC for short. And here's something really key, something that makes it different. It actually lacks a cell wall.
Lacks a cell wall.
Exactly. Unlike loads of other bacteria. And that's not just some, technical detail. It changes everything. Think about penicillin, right?
Yeah.
A go-to antibiotic. It works by targeting the cell wall. So against CBPP, pretty much useless because there's no cell wall to target. It totally changes how you approach treatment, or more accurately, why treatment can be so problematic.
Wow. So, okay, that basic difference, no cell wall, means a lot of our standard antibiotics just don't work. That must really limit the options. And the impact, you mentioned, is huge. The World Organization for Animal Health, WOAH, they list CBPP as notifiable, right? Governments have to report it.
That's right, which tells you how serious it is.
And it causes these huge economic losses, high sickness rates, high death rates in herds. And even though it's gone from places like North America, Australia, most of Europe, it's still really widespread in sub-Saharan Africa.
Absolutely. Still a major problem there. And you see sporadic cases in parts of Asia, the Middle East, too. It definitely crosses borders, a true transboundary disease.
Okay, so how does this thing actually manage to spread and stick around, even across borders? What's the mechanism there?
Well, the main way it spreads is through the air. An infected animal coughs, and these tiny infectious droplets get inhaled by other cattle. Now, the bacteria, they don't actually survive very long out in the environment. So it really needs close, kind of repeated contact between animals.
Ah, okay. So not like something lingering on a fence post for days.
Not really, no. Think more like shared water troughs, crowded grazing areas, cattle packed together during transport. That's where it typically happens.
Makes sense. But are there other ways it can transmit? Less common ones, maybe?
Yeah, there are. The organism can sometimes be found in saliva, urine, even uterine discharges. And it's possible for a mother cow to pass it to her calf before it's born. That's transplacental infection.
Right. But you mentioned sneaky tricks earlier. What's the big challenge?
Ah, yes. Here's where it gets really, really difficult. The biggest hurdle for controlling CBPP is the existence of chronic carrier animals.
Chronic carriers.
Exactly. So cattle that get sick but survive the infection, they can actually carry the bacteria inside them for months, sometimes even years. And they often show no obvious signs of being sick. The bacteria hide away in these walled-off lung lesions. We call them sequestra.
Sequestra, like little walled-off pockets?
Kind of, yeah.
And then-
Encapsulated bits of damaged lung tissue. And the bacteria can just sit there, dormant almost. These carriers look healthy, but they can suddenly start shedding the bacteria again, maybe if they get stressed, like during a drought or long journey, or if they get moved into a herd that's never encountered CBPP before. Boom, you can have a whole new outbreak. They're like hidden reservoirs of infection.
That sounds like a nightmare for farmers. If they look healthy, how do you know they're carriers? Is it just waiting for an outbreak?
It's incredibly difficult. That's a huge part of the control problem. You can't just look at a herd and pick out the carriers.
Okay, so let's shift to what you can see. If you're looking at a herd where CBPP is active, what are the signs? You said the incubation can vary quite a bit.
Yeah, it's quite variable. Typically, you might see signs maybe 3 to 8 weeks after they get exposed. But honestly, it can be anything from 3 weeks up to 6 months. It's a wide window. And the disease itself can look different. You can get acute, subacute, or chronic forms.
Right. So let's take the acute form first. You said that's common when it first hits a herd.
Yeah.
And potentially very deadly.
Very deadly, yeah. especially in a naive herd, one that hasn't seen it before.
Yeah.
Mortality rates can shoot up, sometimes even reaching 50%, half the affected animals.
Wow, 50%. That's
Yeah.
huge. What does that look like?
Well, it often starts suddenly. High fever, like up to 107 Fahrenheit, that's 41.5 Celsius.
Mm-hmm.
They go off their food, look really depressed, lethargic, and then the breathing problems kick in. Severe respiratory distress. You'll see rapid, shallow breathing. Vets call it dyspnea and tachypnea. It looks painful.
Painful breathing.
Yeah, and they often stand in a really characteristic way to try and make breathing easier. Head and neck stretched out, elbows pointing outwards, maybe their back is arched, trying to open up the chest cavity. They'll often have this dry, hacking cough, especially if you try to move them.
Hmm.
You might see some nasal discharge too, maybe frothy saliva around the mouth. And if it's a dairy cow, milk production just plummets.
Okay, that's the acute picture. What about the animals that survive that initial onslaught, the chronic form?
Right, so those that survive the acute phase might develop this chronic form. The signs are usually milder, kind of come and go, maybe a cough when they exert themselves, gradual weight loss. Sometimes the low-grade fever pops up now and then. But the really crucial thing here, connecting back to the carriers, is that these chronic animals might look like they've recovered, but they can still be infectious, still shedding the bacteria.
Still a hidden threat.
Exactly. And then there are young calves. In calves, CBPP often looks quite different. Instead of the really obvious lung problems you see in adults, it frequently causes polyarthritis.
Polyarthritis, joint problems.
Yeah, inflammation in multiple joints. So
Yeah.
you'll see swollen joints, lameness. That's often the main sign in young calves, not the pneumonia.
Interesting how it presents differently. So, with all these signs, sometimes subtle, sometimes different in calves, is that why looking inside after death is so important? The postmortem?
Absolutely critical. A postmortem exam is often what gives you the first strong presumptive diagnosis because the lung lesions, the damage inside, are highly characteristic of CBPP. You see things you don't often see with other pneumonias.
Okay, paint us a picture. What do those characteristic lesions look like?
Well, often the first thing you notice when you open the chest cavity is a lot of fluid, usually yellowish, maybe cloudy, sometimes with little bits of fibrin floating in it. That's called pleural effusion. And the surfaces inside the chest, the lining of the ribs and the outside of the lungs, they're often coated in this thick, yellowish sort of fibrous layer. That's fibrinous pleurisy.
Sounds dramatic.
It is. And another really common finding in maybe 80–90% of cases is that only one lung is affected, unilateral pneumonia. And the affected lung itself, it's usually enlarged, feels solid. But the really classic sign is when you cut into it, it has this marbled appearance.
Marbled, like a steak.
Sort of, yeah. But definitely not something you want to see. It's caused by the walls between the lung segments, the interlocular septa being massively swollen with fluid, and these swollen septa surround patches of lung tissue, the lobules, that are consolidated, solidified, and they can be different colors, red, yellow, gray. It creates this striking marbled pattern. It's quite unmistakable once you've seen it.
Wow, that visual marbled lungs really sticks with you.
And then, especially in those chronic cases we talked about, you find the sequestra. Those encapsulated, walled-off areas of dead lung tissue, that's where the mycoplasma can hide out for ages. Seeing those is another big clue.
Okay, so those postmortem signs are pretty clear indicators, but you need the animal to be dead for that. How do vets and animal health officials actually confirm it in live animals? And then, crucially, how do they try and stop it spreading?
Right. You definitely need lab confirmation for a definitive diagnosis because, as dramatic as the signs can be, other severe pneumonias can sometimes look similar. So for diagnostic tests, the sort of gold standard is actually growing the bacteria, isolating and identifying the ohm organism from samples, like that pleural fluid or bits of lung tissue from a postmortem. That takes time, though.
Culture takes time.
It does. So increasingly, they use molecular tests like PCR, polymerase chain reaction. It's much faster and very sensitive for detecting the bacteria's DNA directly in samples. Then you've got blood tests, serological tests. These look for antibodies the animal produces in response to infection.
Ah, okay, so that tells you if the animal has been exposed.
Exactly. They're really important for surveillance, like checking herds, and also for certifying animals are free of the disease before they're traded or moved. Common ones are the CFT, that's the complement fixation test, and SALISA, the competitive ELISA. There are also some quicker field tests, like the latex agglutination test, which can give you a rapid idea at the herd level, though maybe not as precise as the lab tests.
Okay, lots of tools in the diagnostic toolbox. Now, how does control work? Does it depend on whether CBPP is already there or not?
Absolutely, it varies hugely. In regions that are currently free of CBPP, like North America or Australia, the main focus is just keeping it out. Strict import rules, quarantine for imported animals. If, despite that, an outbreak does happen, the policy is usually pretty drastic, stamping out. That means culling all the infected animals
Mm.
and all the animals that might have been exposed, plus strict quarantine zones and movement bans to stop it spreading further.
Right. Tough, but effective if you catch it early. But what about places where it's endemic, where it's already widespread, like parts of Africa? You can't just cull millions of cattle.
Exactly. Stamping out isn't usually feasible or socially acceptable in those situations. So control there relies on a combination of different strategies. Vaccination is a major one. They use live attenuated vaccines, meaning the bacteria is weakened but still alive. The most common strains are T144 and T1 ear. Now, vaccination can definitely reduce how sick the animals get and lower the death rate. But the immunity often doesn't last that long, maybe a year, sometimes less.
So you need repeat vaccinations.
You do. And crucially, the current vaccines might not actually stop an animal from getting infected altogether or from becoming one of those silent carriers we talked about. So vaccination helps manage the disease, but it's usually not enough on its own to eradicate it. It really needs to be part of a bigger package.
Okay, so what else is in that package?
Movement control is vital. Trying to regulate how cattle are moved, especially large herds moved by pastoralists over long distances. That's a major way it spreads, so controlling that movement is key, though often very difficult to enforce. Then there's treatment. Antibiotics can work. Things like tylosin, venlafaxine, oxytetracycline can treat sick animals.
What, didn't you say treatment was discouraged earlier?
Ah, yes. This is the paradox. While you can treat individual sick animals effectively, official control programs often discourage widespread antibiotic use. The big worry is that treating animals, especially if the treatment isn't perfectly effective or fully completed, can lead to more of those clinically recovered but still infectious carriers.
So treating them might make them look better, but they could still be spreading it silently.
Precisely. It can mask the problem and make eventual eradication even harder. It's a really tough balancing act between animal welfare in the short term and disease control in the long term.
That is a tricky situation. So besides vaccination and movement control, what else?
Biosecurity is always important. Basic stuff, but crucial. Minimizing contact between herds, disinfecting equipment, vehicles, markets, ensuring clean water sources, anything to reduce the chances of transmission. And finally, ongoing surveillance, constantly monitoring herds, using those diagnostic tests to detect cases early before they spread too far. In some endemic areas, if they identify an infected herd, they might still opt for targeted culling to try and eliminate that pocket of infection.
It sounds like a multi-pronged attack is really needed in those endemic areas. No single silver bullet.
Definitely not. It requires a sustained, coordinated effort using all these tools together.
Okay, so wrapping this up, what's the big takeaway for listeners? What does this all mean?
Well, it seems clear that contagious bovine pleuropneumonia it's a really formidable opponent. It's tough because it's so contagious, hits the animal so hard, and especially because this persistent, sneaky problem of the carrier animals. Exactly. And the implications are huge. It causes severe economic hardship for farmers and communities reliant on cattle. It really highlights why things like international cooperation, good surveillance systems, and smart strategic control programs are so critical. We need all of that to manage its spread and protect, the global cattle industry and food security.
And maybe a final thought to leave you with. Think about those hidden carriers, those animals that look perfectly healthy but are secretly spreading disease. It really underscores this constant, often invisible battle we face against pathogens. How just one seemingly healthy animal, in this case, can pose such a massive risk to an entire agricultural economy. Makes you wonder, doesn't it, how many other silent threats like that might be lurking out there?